Everyone. Today I'd like to talk to you about our longitudinal student APPE program that we have here at Roswell Park. My name is Allison Monahan. I'm currently the inpatient pharmacy manager and the coordinator of the student program. And with me today, I have Jordan Scott, who's gone through the program as a student and then one of our PGY2 residents, and now is a clinical specialist on the heme team. So thank you, Jordan, for joining us.
Thanks for having me, Allison.
So just a little bit about Roswell Park. So if you didn't know, Roswell Park is an NCCN designated comprehensive cancer center. So we're actually one of 45 in the United States. And fun fact, we were one of 3 original NCCN centers. This year, we were named on Forbes Best Employees in New York State. We were in the top 3, which is great. So what is our longitudinal program? So for UB students, it's a 16-week total experience at Roswell Park with the option to add on additional rotations. So we have our 3 core rotations that you go through. The first being inpatient operations, and you do get to see our infusion center as well. The second rotation, which is 6 weeks, is your inpatient acute care. And the next rotation is your ambulatory care clinic rotation. So students, like I said, the core of the program is a 16-week experience. There is the option to add on different rotations, which we'll talk about in future slides. And we'd like to stress that because you're working with a lot of PGY2 trained clinical specialists, it is a residency-like experience, and we find that our students really enjoy that. So first, I'll talk about your operations rotation experience, which I know it says 4 to 6 weeks, but for you UB students, it's 4 weeks. Our students do a ton of non-sterile compounding, which they really enjoy. They make capsules, they make suspensions for our patients, and we really rely on them to get a lot of our compounding done. So you'll learn a ton about that and about the USP 795 requirements. Our pharmacy is a little different than other inpatient pharmacies in that we are primarily processing a lot of chemotherapy. So you'll learn about the regimens, you'll learn about dosing and how we look at labs and other parameters to determine if a chemotherapy is appropriate. Like I mentioned before, you'll see our infusion pharmacy, which is a newer building where we treat a lot of patients. And the last thing we do, well, among many others, is PK dosing. So we're actually in the process of implementing some new software that actually our current students are helping with. So you'll be able to do the dosing and monitoring yourself. You'll write the notes, and you'll be largely involved in that process. I do want to mention that our students in Central do work with our medication safety officer and do a lot of extra projects on the side if they're interested in it. So you can look at, RCAs that occur, adverse events, any issues that come up, and kind of work on being a little detective and going through these events and determining how we can prevent them for the future.
So just to add a little bit to that, when I was a student and kind of did my operations experience as part of my longitudinal rotations, I really enjoyed the experience as a whole. I thought it offered a really diverse profile of things to learn as a student. We get to do a lot of compounding and a lot of unique compounding that you don't necessarily see at a lot of other inpatient or in hospital pharmacy operations experiences. So that was extremely cool. And then learning the process for verifying chemotherapy and kind of what we go through, how we do double checks for everything, and working with our clinical pharmacy generalists in the central pharmacy really did help me become a better pharmacist, student pharmacist to then be a pharmacist once I was done. I will say there's tons of opportunities for projects as well. I participated in some of those med safety projects and also helped bring some drugs to formulary by helping complete the monographs and presenting those at the pharmacy and therapeutics meeting. So there's a lot of opportunity for students to step in and kind of really take control of a project that they can help to use to bolster their CV and get some experience while they're here. Next, we have our inpatient acute care experience. And so there's kind of a wide array of opportunities available here. We have an intensivist team that rounds in the ICU. We have a hospitalist team. And then all of our hematologic malignancy teams have inpatient services, so bone marrow transplant, lymphoma, and leukemia. So you'll get to partake in those interdisciplinary rounds where we're kind of following patients on the regular, looking at their medication profile, making recommendations on what we can do and how we can change and optimize their therapy. We do a lot of medication history, so we're making sure that the medications the patients are coming in on are the medications they're actually taking at home. And then I like to say that we as pharmacists tend to bookend a patient's stay when they come to the hospital here. So we'll talk to them when they get here and talk about their meds, and then we'll do a lot of discharge counseling when they leave. So making sure that they're coming in and going home on the appropriate medications. It's a really great opportunity to get some hands-on patient interaction to where you're talking directly with the patients and you're working directly with the team to ensure that the medications are right on admission and right on discharge. And then obviously the one thing you're going to get on probably any rotation that you have here at Roswell are drug information questions. And a lot of them are pretty off the wall questions because we're utilizing drugs and chemotherapy agents that either don't have a lot of literature behind them or are much more unique to our patient population. We get some pretty interesting drug information questions. And so I can tell you from my experience with precepting students, oftentimes they're teaching me things because these drug information questions we get asked are things that I even don't know. And as a group, we're kind of looking for the right answer and we're working together to figure out the answer to these questions. And then finally, it brings us to our ambulatory care experience. And so this is really the bulk of where our clinical pharmacy specialists are here at Roswell Park. We have ambulatory clinics for basically every single malignancy, and they're disease state specific. So we don't have a clinic just for our blood cancers and just for our solid tumor cancers. We have clinics for the GI cancer, the thoracic or lung cancer, the lymphomas, leukemias. And so we have a clinical pharmacy specialist in each of these clinics. One of the things we do a lot of is chemotherapy education. It's honestly my favorite part of my job. And I got exposed to a lot of it as a student and really love that. We go in the room and we spend time with the patients going over the regimen, when they're starting, supportive care meds they're taking, how they need to take their medications, and really answering all their questions about side effects and everything. We oftentimes sit in these clinics right next to the providers, right next to the physician, the PAs or NPs. And so we're kind of working with them on making recommendations, helping to optimize therapy for patients. And by sitting there, kind of hearing them talk about the rationale for treatment and things, you really do develop an in-depth knowledge on the disease state, on the type of cancer that you're in the clinic for. So this is definitely the most unique experience you're going to get here at Roswell. This is unlike any other rotation that you'd be able to do at any other place in the local Western New York area. And so I kind of mentioned that we have specialists in every one of those areas. So these are kind of all the areas that we have clinical pharmacy specialists that are sitting, whether it be in clinic or on the inpatient service. So as you can see, we have a wide array of clinical pharmacy specialists who are all excited and willing to take on students on rotations and be able to teach and help you grow in your development and learning about these various areas of oncology. So there is no shortage of a variety of different type of experiences we have to offer here at Roswell. And we would be super excited to have you as a student on a longitudinal rotation to kind of be a part of any number of these different clinics or areas that we offer.
All right, thank you so much, Jordan. I'll just take over for a minute, just to mention, like I mentioned before, the add-on rotations that you can do that really enhance your experience here, especially if you're working on longitudinal research. It kind of gives you extra time to really get into those projects, and get involved with our PGY2 residents. So I think that is something unique that we offer, administration being one of them. So we do have pharmacists that have been residency trained in pharmacy administration, which is a unique experience to kind of learn about their route and their path through administration. You'll get to participate in a lot of committees, a lot of meetings with physician leadership and other nursing leadership in the hospital, to work on solutions. Our medication safety, Jordan and I have mentioned it a couple of times, but it is a really unique program here. So we have a full-time pharmacist and an analyst dedicated to this program, which really helps students to learn about medication safety and how it becomes a value of all pharmacists and prioritized in our hospital. I think the projects, students get a lot out of them. They're very interesting and eye-opening, as I mentioned. And then retail, I'll let Jordan talk about since he actually spent some time there as a student.
Yeah, so I did retail as kind of an add-on. I did the longitudinal, and then my retail rotation was with the Roswell Park Retail Pharmacy, and it's a really unique experience because they do a lot of specialty medications. So you're not seeing a ton of you'll see the common medications, but you're seeing a lot of different oral chemotherapy and oral anti-cancer treatments that our patients here at Roswell are on. So when you're in the clinic, you'll see us talk about the medications we're using orally. We'll prescribe them, but the retail pharmacy lets you kind of see the other side of things. And we're currently looking to expand the role of students in this area. There's thoughts that we could do a little bit more oral chemotherapy monitoring and follow up with our patients on oral chemotherapy. And from my time there, it's not an extremely busy retail pharmacy, which gives you a little bit more time to kind of dive in and better understand some of the specialty medications that we're dispensing, the reason for those, the supportive care around them, and you're working with the same group of providers and pharmacists that you worked with on your other rotations. So it kind of helps with that continuity residency-like experience that you can get from doing a longitudinal rotation here.
Great. Thank you so much, Jordan. So as we mentioned before, I think our longitudinal program really stands out because it's excellent residency preparation. I was a student here myself, and I credit Roswell Park in my rotations largely with going on to do a PGY1 residency. So kind of we want to enhance that even more this year. So we will be doing some mid-year informational sessions just to kind of as a Q&A to guide the students on how to navigate mid-year and where to spend your time. Also, we'd like to do some interview prep sessions. I interview a lot of students and interns, and I can tell you that getting ahead of interview prep is a huge part of scoring a residency or a job even. So we're here to help you with that. And then clinical presentations, you'll do plenty of these on your clinical rotations. And I know that my experience in leukemia clinic really helped me prepare a presentation and be able to confidently present it at any of my residency interviews. Jordan, do you have anything to add on that?
Yeah, I'll say the clinical presentation prep is huge. There's opportunity to put together clinical presentations on patients that we have here. They're very complex patients. I can say from my experience, I used some of the cases that I'd put together when I was here as a student on my residency interviews. So they definitely came in handy. It gives you the ability to talk about some complex disease states. And it's something that was really beneficial to me in going through the whole residency process. Now there's kind of I see there's two real big benefits to doing the longitudinal here. One of them is kind of what we've already talked about, but doing 3 rotations here means that you're going to be using the same EHR, working in the same computer system with the same people for 16 weeks, which prevents you from having to have a new learning curve on each one of those rotations if you were to do them at different hospitals, and allows you to kind of seamlessly flow between your rotations and be able to kind of pick up and focus more on the clinical learning rather than the operational learning of having to learn a new EHR and kind of the logistics around how we do things. The other big benefit is being involved in projects. And so I was involved in a couple projects, and on the screen you have listed just a few examples of residency projects where students were involved, played a key role, and got their name on the publication that was submitted, whether it be an abstract or a full paper. I can tell you from my experience, one of those projects is my residency project, the very last one, where I had a student who was involved in the project. And then as a student, I was involved in a couple of these projects while I was here. And it's a really great learning experience because if you're interested in residency, research is something that every program pretty much has you do. and having a leg up by getting a little bit of experience and learning that research process through participating with the residents we have here can be something that's very beneficial to you. The other thing is there's opportunity for projects outside of these major research projects that you see. There's always things that are popping up, whether it be new guidelines, whether it be bringing drugs to formulary and doing monograph presentations, journal clubs on new literature that's coming out and kind of learning and discussing how to analyze literature and the things we're looking for, as well as sitting on various hospital committees. I can tell you I attended meetings as a student for the anticoagulation committee, for the oral chemotherapy committee. And because I was involved in those as a student, I've actually continued on some of those committees now as a clinical specialist here. So definitely opportunity to grow and to learn kind of about some of the other, or what we call the ancillary responsibilities of a pharmacist in the hospital setting. And I can tell you with confidence that if you do a longitudinal rotation here, some of these things will pop up and you'll have the opportunity to work with a specialist or a resident on some of these projects that we have. And it is really great preparation for a residency program in the future.
All right, thank you so much, Jordan. So the application process. So you can email a CV and a short letter of intent to me, and my email is listed below. I generally do a short phone interview, and if you are selected, we will work together to choose your rotations based on what you're interested in. So there is some flexibility. We don't just assign you rotations. We really want to engage students and get them involved in things that they have interest for. You can also, if you have any questions, since Jordan has gone through the entire process, his email's here as well, and he's happy to answer any questions and share more of his experience. So thank you so much for joining us, and we look forward to hearing from you.